Hey YouTube, new video. I've been asked a lot of questions lately about my first aid kit, and I went back through the channel and I thought I put some stuff in it about my first aid kit, but it seems like I didn't. So I thought I would remedy that situation and put my kits on now. It'll be a two-part video. On the first, because I carry my first aid kit in kind of a two different, and I'll explain a little bit the why on this, because the first kit is a little bit smaller than the second one, and on the second one I'll do more on this kit. So first, there'll be so my kits now are separated. So my philosophy on first aid kit. Um, First, I want to make sure that I make the difference. So there's first aid kit, and I don't know yet what to call them, but long-term care kit I would call. So my kits now that I do for 72 hours, well, 72 hours would be still in the first aid kit, but like my 2 months kits and stuff, they're more than first aid. So we're talking about more long-term care. They have a different purpose. We're talking about long-term wound care management. We're talking about more serious thing. The medical system is not there, so you have to be more reliant on yourself. So first question you always have to ask yourself is the kit is for what? Here you'll have two kits. One is what I have in my 72-hour bag. And so this is usually when I'm in the city. Being in the city, that means the use of it is quite different as well, because I'll have case where the ambulance is coming, or a situation more like active shooter would be more something that I'm kind of looking at. So that is more the purpose of that kit. But that said, I still in my long-term kit, well, in my first wilderness kit, which is this kit here, which I'll talk on the next video, I still separate the portion I'm going to be talking in those little case. And so what I do is I separate my case in what I would call trauma or right away situation. So things like CPR, um, like I said, trauma, major bleed, because you don't want to, for example, open a kit like this in the middle of somebody bleeding. You want something that is easily accessible, as well as, for example, when I go kayaking, as everything is in the cockpit, I have to have something near me if an emergency would happen to have. So I have kits that are separate. So smaller kits for more like, for example, in kayaking, I have a smaller kit on my what we call a deck bag. And in that kit, I have more things like nausea, and also I got a kit like this for trauma. And this kit is more in the back, so that way if something happens and I need emergency right away, I can access those kits. Those kits are smaller, they're compact. When I carry in the wilderness, this kit is kind of on the top of my backpack. So this is why I have the content that I have in those kits and not in that one. I can double or add more to this one, but that means that I have to access this kit. So that means, for example, if I would be hiking, that would be at the bottom of my backpack. So I would have to open my backpack, take all of this. Versus this, I can access right away, give that to someone, or me taking care of it while accessing long-term care. So this is what the philosophy of it. And I'll put a link down. Reading more about for different purpose and presentation that I'm doing and stuff. I've been reading a little bit more about combat first aids, and it's so I've talked about that in the past in my videos, where Auster medicine has took over what we call wilderness medicine. A lot of people. So Auster medicine is medicine in a situation outside the grid. And now they kind of have, because before people used to call wilderness medicine, and now it's like, well, what about the disaster? Oh, yeah, that would be also a type of medicine. And what about combative medicine? Oh, yeah, that would be another. So now the big term is auster medicine. And then you have kind of a separate branch that has different purpose. For example, wilderness medicine is a medicine that you're doing outside the grid, but it has a different approach that if you're under fire, which is more combative medicine. Combative medicine has a mnemonic called March, and I really like it. And so now when I do my kits, that's what I base on. And the mnemonic is massive hemorrhage, airway, respiratory. The C is for I think cerebral hemorrhage or something like that, and consciousness, and the H is for hypothermia and hypoglycemia, I think. So anyway, so most of my kit now are based on that. So that said, let's open this kit. Again, this is what it comes in. It's in those little Pelican case, so it makes it waterproof, crush proof. So that's great for like having. It contains everything that I need, and again, easy to get, grab, and identify. So let's open this kit, and we'll talk a little bit more about what I carry. So before we talk about the first kit, I want to mention that I carry also a naloxone kit. I'll put a link below on how to use those and videos about how to carry those. One of the reasons I carry those here, again, this is for my city kit, is that we have a lot of overdose in my region, and so one intervention that we have to do is give what we call naloxone. And what naloxone is an antidote for opioid overdose. And so basically you inject that, and we give those kits for free here with some training because that can save a life. So if it's one program that you have in your area, make sure that you get one and you have one in your kit. And again, I'll post videos on how to use it and what they are about and stuff like that. So I'll put it down. But now to our talk. So my little kit over here. So what I do is I carry 2 tourniquet, and I'm even maybe thinking about increasing. So one of the purpose of this kit is again trauma, um, but also active shooter. So obviously, if there would be an active shooter, I would need more than 1 tourniquet or even 2 tourniquets. So having multiple tourniquets is a good thing. Um, so what I do is I carried it outside the kit, and I attach it with a little bungee, which the bungee can be used for other stuff as well. When you buy a tourniquet, make sure, well, first of all, make sure that you get trained on how to use them properly. I'll put an article below on the ones that they recommend and why they recommend them. Doesn't mean that the other ones are not good. It's just they have a different purpose. So in auster medicine, especially combative medicine, um, the purpose of those tourniquets that you carry them like with you, and then you be able to apply it on yourself with one hand, because obviously if I got shot in this arm, I cannot use this arm, so I have to be able to use it with one hand. So in my other kits, I carry the soft, not soft, sorry. So the 2 tourniquet they recommend is cat and soft. And the tourniquet that I carry is the SWAT, which is kind of a big, kind of a large, kind of rubbery substance that can stretch, and that's how you get your tourniquet on. But it has multiple purpose as well. I'll put a link down on the purpose. So one of the reasons I carry them is that they're compact, they're small. This is a little bit hard to and then you don't want to bend them also because of the piece of or the rod over here. So sometimes in first aid kits they're hard to carry, and so for example in my PFD, when I kayak, I do carry one of those soft dressing, and it's right on the side of my pocket. that I wouldn't be able to carry, in this with salt water, I'm not sure how I would survive. Versus the other one is wrap it in his own bag. It's very easy to carry, and so if I have an emergency, I just open my PFD and I can use that kit for a different purpose. That's why I carry this off. So that doesn't mean that they're not good, but it's just you have to know why you're using your tourniquet. But because I'm about to use them in a condition of public or with other people, I may pass this one. And active shooter, that means I may be the one that injured, and so I'm using the ones that they recommend for that. I won't be talking about how to use a tourniquet. Get yourself trained. There's tons of videos out there. Just make sure that you follow the right videos too. And like I said, I'll put an article, a link below on our article, and why to the use of tourniquet. So the box is based on the mnemonic called March, and it's the mnemonic that they use for in the combative um, training for first aid. And I kind of like it because it responds to main region that main things that you may have to act quickly. So again, it's not for boo-boo. That's like, life and death situation. So I find the mnemonic works well, and so that the box is based on. Then once you open over here, what I got is first thing is a pair of gloves. The second thing that I got in here is a little kit, and it's an NPA. So NPA stands for nasal pharyngeal airway. So why an NPA, not an OPA, which is oral pharyngeal airway? So as you can see, oral comes to the mouth, nasal pharyngeal goes to the nose. Is that the nasal pharyngeal, first, they're flat. It's easier to put in. The other thing too that you can do with those is that you can modify them. So they have like a bevel on side there, and so when you put them in after the measure, but if your measure, and I'm not here is just to talk about my kit, not how to use those, get trained to how to use them properly. But if your measure is too long, you could modify this, which an OPA you can because it's too solid of a plastic. So that's one reason I like to carry those ones. I carry longer ones so that way I can modify them to put in smaller people. But the other advantage of this versus an OPA is that even if the person is semi-conscious and still have a gag reflex, so the gag reflex is when you go brush your teeth and you go too far, like you bring that up. So person that are kind of semi-conscious, they still may have their airway compromised, but you cannot put something in the back of their throat or else they'll vomit or even worse. So the NPA, you can't put that. So in emergency, a lot of time we get drunk people and we put that and they're semi-conscious, but it's just to protect their airway. And so that way we can still monitor them, but not all the time having to hold their heads and stuff like that. So that's the advantage of NPA. And as you can see, you can carry even more than 1 or 2, and I may do that as well in that kit because again, it's for active shooters. So that means you may have more than one victim. So that means I can put this in one victim that is just seemed to be having airway compromise. So it looks like she's unconscious, then go to another victim, do something else. And so this kit can fill out a few. Obviously, you don't want to, my purpose is not to be there for everyone, but as many patients or victims as I can handle, hopefully that kit do, and so this can carry extra ones. I keep lubes in it because when you put them in, you want to be sure that you put it with some lube, so and it doesn't take as much space. So the other thing too is I carry is a pair of scissors. So a lot of people talk about EMS shears. This is what we call bandage scissors, and so for nursing is when we could bandage. They do exactly the same thing as EMS shears, so they have this protective region, so that way you can slide them on skin and don't hook it up, and so there's no like pointy corners. Everything is round, so that way like if I can go on the skin, because obviously if I'm cutting a bandage, I have to go and I don't know exactly what's under, so then I wouldn't damage or pointed it or entered it into the wounds like your normal scissors, which are more pointy. Um, and the reason I go with those smaller ones, one, they're more compact so they can hold in a kit like this. But two, as per experience, a lot of time what happens with EMS shears, they can do what I just did now with my scissors. And so you go to cut with stuff, and if it's like close or it almost like at the pivot point over here, they have like a weakness. And it happens to me a few times with some EMS shears. And then basically you go to cut and the scissors kind of lose their stuff, which I find with those ones, but those ones are the cheap ones. But with a good pair of bandage scissors, that situation doesn't really happen. And they're smaller and they're compact to put in. So I recommend those ones versus. And so again, this has multi-purpose, is to cut the clothes or bandage that you're doing and things like that. So a pair of scissors. Then I have again in the bleeding, because obviously this is for trauma, so that's kind of heavy on the breathing, on the bleeding, not the breathing. The Israel bandage, and for those that never open one, first of all, do open one and practice if you're going to carry it. But the second thing is that they have a double package. So the more aluminum one that you mostly see them when you look at it online, this is what's it's inside that aluminum one. And I prefer carrying them like this. It's still kind of protected, it won't get wet or stuff, plus the case. And I did videos in the past, clean versus sterile. In the field, sterility is useless. It doesn't exist. So you want to keep it as clean as possible, but sterile is useless because the wound is not sterile. So as soon as you apply this, sterility is gone. So you want to decrease the number of contaminated that you put, so that I don't blow my nose with something and then put it on someone. But to keep it in that package, that's sufficient. So I always take them out of their kind of aluminized package because it's easier to package inside. So yeah, it's real bandage. A lot of people hear it about it. It has multiple layers of kind of abdominal pad, but depending on the size that you have, but they're gauze pretty much in there. Those can be applied, and there's like a little plastic. You can see it maybe a little bit here, there. There's a plastic so that you can do pressure dressing because the plastic kind of rod stays on top, and so basically when you can put a little bit more pressure, and the pressure is going to do exactly where you want it. So that's the advantage of those Israel bandage, and it fits great in that little package. So talking about dressing, the other one that talking about dressing on now, I'm just going to point out, a lot of people talk about tourniquet, 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 and tourniquet. And yes, they're important, but there's something before tourniquet. Tourniquet is like the third step in wound management, or like to stop bleeding. The first one is pressure, direct pressure, and any things that you read about, it's direct pressure. But everybody goes straight to the tourniquet. But what you want to do is direct pressure first, pressure dressing second. And if that doesn't stop your bleeding, then you go to the tourniquet. Obviously, if somebody got shot in the leg and the leg is half gone, sure, go with the tourniquet. But if you're just cut yourself and you're bleeding, don't go put a tourniquet right away. There's other steps you need to do before you're doing that. And so direct pressure, and we'll talk about the controversial of the two next thing I'm going to talk about. Direct pressure is this, not this. So the difference between this and this is that this, I'm applying a pressure directly where it's bleeding. If I'm doing this, it's too wide of a region, and I'm not applying direct pressure. So the problem is a lot of people, when they put dressing, they do this. That's not a direct pressure. That's what a direct, you want like to get your weight in that stuff and almost hurt when you put the pressure, because what you're trying to do is the coagulation at the site. So a lot of the people they there's a lot of um, using like tampons, and this is what tampons are, and so you can find them, at the dollar store and stuff. So one of the reason I use those is that first of all, they're very compact. Uh, Obviously, they say that about the absorbance, and this is what the issue is. Is a lot of people they use that because they say, "Oh, it's super absorbent," and then when they apply it, but the problem is that they apply it this way. So then the blood accumulates in there and there's no direct pressure. So what you want to do is apply a direct pressure, and whatever dressing you're going to use, the direct pressure is what stops the bleeding, because the blood will accumulate, and then there's kind of fibers that accumulate a little bit like an accident where everybody would kind of collapse, and then at one point those fibers will collapse, and this is what a clot forms, and then it stops the blood from coming out at the vessels. So this is why you want to create the direct pressure. If I'm just doing this, basically I'm just letting the space being bigger and less chance of those little crisscrossing and fibers to get into contact and then creating the clot. So a lot of people go against that, and because of their misuse. The reason I'm using them is because they're cheap and they're self kind of contained over there with the plastic. And I got that thing at the dollar store, and they fit well into that kit. But again, it's not about the dressing itself. It's not about it's about the direct pressure that you want to apply. If you just apply this and it absorbs, that's the danger of those dressings. So this is why I carry those ones, because again, you know me, I don't use a lot of gauze, so I prefer using those ones because they're more self-contained. They have a plastic on it. It's easier to keep clean than most gauze I have or I could get. Um, the other thing that I may think about adding to this kit is a anticoagulant. So things like Silox or Silox. I don't know why I always say the I there, but Silox, and the other brand there that I kind of forget now. But you want an anticoagulant dressing. One of the reasons that they're good to have in those kits is that a lot of people now are on anticoagulant medication, like I'm having a blank on post night, so sorry about that. But I'll put a name of some of the medication that you may see, because people have atrial fibrillation or arrhythmia in their heart, or post strokes, and so they're on a lot of medication with antiplatelets and stuff, which prevent that coagulation, that little fibers to connect, because they don't want to make more clots, because they don't want to have a heart attacks, but at the same time, or have a stroke. But at the same time, that means that when they're bleeding and cutting themselves, they won't be coagulating themselves. So it's very important to have a part of it in there. Usually they're pretty big, but there's some that you can buy for nose that I carry in my other kit that we'll talk about. And that would fit well in there, because if you put this just at the wound plus another dressing on it, the medication that is inside the antiplatelets will coagulate. So you don't need like the big pad to do it, as long as there's the active ingredients cutting on it. So I use a lot of them for my for nose, and this is why they're smaller strip, so they can be used for dressings at different levels. So I prefer them than the big pads that they use for wounds and stuff, because it's easier to do direct pressure. I don't expect that I'm going to be doing, again, in kits like this, just the ambulance is coming, so I'm not expecting to do like big dressing change or big explosions or stuff like that, because somebody else is coming to take over. So that's why I don't carry those, versus a lot of those kits are for military people, or policemen will have to take care of their own. So that's why they have like the specific medication for it. But mine is more for helping other people. So, and then two adds-on that I have, and it's there you go, honey. So first of all, I can use that for burns. I can use that for hypoglycemia because that's another emergency that people may have. So if you're somebody that passed out in front of you, you may be able to add some sugar to them. And then another one is I put my medication in there. So this is a little bit controversial. If you're going to do this, be careful, be using it properly, and know that you're doing that. So what I do is I put a bunch of medication inside one container. So this is one dose. So what I have is 1 gram of Tylenol and 800 milligram of Advil. So if somebody's get injured like I'm here, that would be one dose. And so I give them all the medication together. First of all, when you give medication, be mindful that you're doing something that is against some training because you're administering medication to somebody else. Only a doctor can do that, even as a nurse. I need a prescription for that. And two, they could have allergy to this or reaction, so then it becomes on your own term. And three is that you're mixing medication in one container. So there's not only Tylenol in there, there's Advil and stuff. So if you're going to do this, be sure that either whoever, because this is my kit, so I know I'm going to use it, and anybody that would be using it knows how I'm mixing my medication. The other problem with what I'm doing right now is that you may lose your, how when they're expired, so you can put that maybe on the side over here. Another way that would be safer and a little bit more recommended is to have those small pockets that already have medication inside, and so those would fit well into the kit. But I know my meds, I know how I'm doing, and so that's why I do this kit, and so this is why I carry over here. But again, this is a one dose. I put that in the hand of the person takes it, and it's for pain control. So basically, it's to bring that pain right down. So that's why I go with a big dose like that. So this is what the kit. Like I said, I'll put some link below on the reason what I'm doing in the mnemonic of that march, and hopefully that gives some ideas. If you have any questions, just post it below, and then I'm going to do now the next video on the big one in the back.